Hello. Today we will discuss Mennen Medical's sterile cervical ripening balloon with Stylet, also known as a CRB. This catheter is a medical device that helps prepare the cervix for labor. It uses two balloons, as we will see momentarily, one on each side of the cervix, to gently apply pressure and encourage it to soften and open. A removable stylet inside the catheter provides stiffness for easier insertion. Let's see how it comes. As we saw, each box contains 5 individually sterile packages of the catheter. We will open the catheter. Inside is another package. Upon removing the catheter from the packaging, we see that the catheter has 2 balloons. On the other side of the stylet, we have 2 openings, U for uterine, V for vaginal, and in the middle we have the stylet, the guide itself, which enables us to insert the catheter with ease. Now, before we start, make sure the stylet is fully and firmly pushed into the catheter. We don't want it to be hanging out of the side, because that would cause the catheter to be too flexible and cause difficulties in inserting the catheter. Okay, as we can see, the guide wire basically keeps the cervical ripening balloon straight. Prepare a syringe or 2 syringes according to hospital rules and regulations. We will be using them for inflating the uterine and vaginal parts with saline. Now, using a speculum to see the cervix, insert the catheter with the stylet in place. So I will be inserting the catheter, okay, to see the cervix. Advance the catheter until both balloons have just passed the cervical opening. Both balloons have just passed them. Now, once the first balloon is in place, I will remove the stylet. Using the first inflation port, marked U for uterine, slowly inflate the inner balloon with saline. Use at least 40 cc's. So we will have the first inner balloon being inflated to around 40 cc's of sterile saline. Gently, after this is inflated, gently pull the catheter back and until we have both balloons on either side. Okay? When the second balloon should be right outside the cervix. Using the second inflation port marked V, we'll inflate the outer balloon with at least 20 cc's of saline. So we have 40 cc's inside, 20 cc's outside. Now, we're going to check to make sure that both balloons are on either side of the cervix. If they're in the right spot, completely remove the speculum, and now we will start adding more saline to both balloons in 20 cc increments until each balloon is inflated up to 80 cc's. Adjust the volume, of course, as needed for patient comfort. I recommend taping the catheter to the patient's thigh to keep it from moving. Removal is very, very simple. We'll simply deflate each port and gently slide the catheter out. Recommendations is not to leave it in for more than 12 hours. Again, regulations and rules of each medical facility is up to them. Thank you very much.